Spring is here, and across the country, millions of adults over 60 are doing something completely ordinary this week. Opening the cabin that has been closed since October, clearing out the garage, moving boxes in the storage shed, sweeping the back porch. Perfectly normal seasonal routines that most people have done dozens of times without incident. Here is what most of them do not know. For adults over 60, one of those ordinary routines, in one of those ordinary spaces, has the potential to expose them to a pathogen with a case fatality rate that sits between 38 and 50%. Nearly 1 in 2 people who develop the severe lung form of this disease do not survive it. And the biological changes that come with aging make the exposure significantly more dangerous at 65 than it was at 45, in ways that are specific, documentable, and worth understanding before you open that door. The pathogen is hantavirus. And today, we are going to cover exactly what it is, how it gets into your body, what the disease actually does inside you hour by hour, what the real cases looked like, and the 5 things every adult over 60 should do this week, ranked in order of importance, with the most critical action last. Stay through the entire video. The item at number 1 is the one most seniors are not doing, and understanding why it matters is going to require everything we cover before it. Before anything else, I want to be direct about something. Hantavirus is a real and serious risk. It is also a manageable one if you have the right information and act on it. Nothing in this video is designed to cause panic. It is designed to cause preparation. Those are very different things. If this kind of specific, practical information is useful to you, subscribe to this channel. This is what I make every week for adults over 60. Now, let us start with what hantavirus actually is. What hantavirus is and how it has behaved historically. Hantavirus is a single-stranded RNA virus that has existed inside rodent populations for thousands of years. The deer mouse is the primary carrier in North America. The critical detail is that the rodent itself almost never gets sick. It simply carries the virus in its saliva, urine, and droppings, and sheds it continuously into the environment without any visible signs that it is doing so. In North America, the strain responsible for the most severe illness is called sin nombre virus, first identified in 1993 during an outbreak in the Four Corners region of the American Southwest. A cluster of previously healthy young adults developed a mysterious, rapidly progressing respiratory illness that baffled physicians at the time. The investigation that followed identified a new virus and established the framework we now use to understand hantavirus pulmonary syndrome. In South America, a strain called Andes virus has been responsible for outbreaks in Argentina, Chile, and Brazil. It carries a characteristic that distinguishes it from all other known hantavirus strains. It is the only one documented to spread from person to person. In 2019, an outbreak in the Chubut province of Argentina produced 29 confirmed cases and 11 deaths, with transmission chains moving through households and documented spread to a healthcare worker caring for an infected patient. Researchers around the world are watching the Andes strain closely as a result. In Asia and Europe, different strains cause a condition that attacks the kidneys rather than the lungs. All of these strains share one characteristic. They exploit the specific immune vulnerabilities that accumulate in an aging body. Why age changes everything about this exposure. Your respiratory tract has a first-line defense system called mucociliary clearance. Tiny hair-like structures lining your airways trap incoming particles and sweep them back out before they reach the deep lung tissue. Research from Johns Hopkins University School of Medicine has documented that this system's efficiency declines by approximately 30 to 40% after age 65. What a 35-year-old partially clears before it reaches the alveoli, a 68-year-old is far more likely to have deposit directly into the deep lung tissue, where hantavirus causes its most severe damage. Alongside this, your innate immune response, the rapid-fire system that attacks pathogens before your adaptive immune system mobilizes, operates at roughly 40% of the efficiency it had at age 40. Researchers at Stanford University School of Medicine have described a phenomenon called inflammaging, where the aging immune system is simultaneously less responsive to new threats and more prone to poorly calibrated inflammatory responses. The practical result is that you may feel less sick than you actually are in the early hours of infection. The warning signals arrive quietly. The disease progresses fast. This combination, reduced airway clearance and reduced innate immune response, is why the same exposure that might produce a manageable illness in a 40-year-old carries a different risk profile entirely in a 70-year-old. How hantavirus enters the body. The primary route of infection is inhalation. When infected rodents urinate, defecate, or shed saliva in an enclosed space, a garage, an attic, a basement, a cabin closed for winter, a garden shed, even the inside of a stored vehicle, the virus particles attach to dust and become aerosolized. When you walk into that space and breathe, those invisible particles travel through your airway and reach your lungs. Research published in Emerging Infectious Diseases has documented that the virus can remain viable in the environment for several days and in cool, dry, sheltered conditions, potentially longer. Secondary routes include direct contact with droppings or nesting materials, followed by touching the face. Rodent bites are a documented but far less common route. The Andes strain in South America adds close contact with an infected person as a documented transmission route, which is why that strain is monitored so carefully. The word that matters in all of this is enclosed. Open outdoor air disperses viral particles rapidly. The risk concentrates in spaces that have been closed off, undisturbed, and potentially occupied by rodents without your knowledge. What happens inside the body, hour by hour? The incubation period ranges from 1 to 8 weeks, with most people developing symptoms between 2 and 4 weeks after exposure. This long, silent window is one of the most dangerous features of this illness. You can feel entirely well and have no idea that a process has begun. The illness opens in what physicians call the prodromal phase. For the first 3 to 5 days, the infected person experiences symptoms that are indistinguishable from influenza: fever, fatigue, muscle aches in the large muscle groups of the thighs, hips, and back, headache, dizziness, and sometimes nausea. At this stage, even experienced clinicians who are not specifically looking for hantavirus would likely attribute the symptoms to a common viral illness. This is the window during which the virus is replicating inside the endothelial cells, the cells lining the blood vessels, and beginning to cause them to leak. Within 4 to 10 days of initial symptoms, the disease enters what is called the cardiopulmonary phase. As blood vessels in the lungs become increasingly permeable, fluid floods the air sacs. The lungs, which should be light and expansive, begin filling with fluid. The patient develops shortness of breath that escalates rapidly, not a mild breathlessness, a gasping, escalating inability to get air in. Oxygen levels drop, blood pressure falls. The heart, starved of oxygen, begins to fail. Hantavirus pulmonary syndrome can progress from the first sign of respiratory distress to complete respiratory failure in as little as 24 to 48 hours. Many patients require mechanical ventilation and ICU admission within a single day of their breathing becoming compromised. There is no specific antiviral medication approved to treat it. Treatment is entirely supportive: oxygen, ventilation, fluid management, and time. This is not a disease where a physician can hand you a prescription and send you home. What real cases have looked like? In May 2012, a cluster of 10 confirmed hantavirus infections was linked to cabins in the Curry Village area of Yosemite National Park. 3 of those 10 individuals died. The CDC investigation found evidence of rodent infestation inside the insulation of the cabin walls. Thousands of visitors who had stayed in those structures were notified and monitored. In Washington state in 2020, a man in his early 60s spent a weekend cleaning a long unused storage barn. He wore no respiratory protection because he had done similar work many times before without incident. Within 2 weeks, he developed what he initially believed was a severe cold. He was hospitalized and placed on a ventilator within 48 hours of admission. He survived after 18 days in intensive care, but spent the following 8 months in pulmonary rehabilitation and reported that his breathing capacity never fully returned to what it had been before. In Colorado, Utah, and New Mexico, public health departments report sporadic cases regularly, particularly in spring and summer when rodent populations peak and people spend more time in outdoor structures. In 2023, the Colorado Department of Public Health confirmed 3 cases of hantavirus pulmonary syndrome, 2 of which involved adults over the age of 65. One of those individuals did not survive. These are not distant theoretical scenarios. They are documented cases from ordinary places, involving ordinary people doing ordinary things in spaces they had been in dozens of times before. 5 things every adult over 60 should do this week, ranked from important to most critical. Number 5, do a complete rodent audit of every enclosed space on your property. Not next month, this week, before you open anything, move anything, or clean anything. Check your garage, basement, attic, garden shed, any outbuildings, your crawl space, and any stored vehicles that sit unused for extended periods. You are looking for droppings, which resemble small, dark grains of rice, gnaw marks on wood, plastic, or food packaging, nesting materials made from shredded paper, insulation, or fabric, grease marks along walls, and the distinctive musty odor that active rodent activity produces. Do the audit with another person present, both for practical help and because you want someone who knows your location if you experience any respiratory distress in an enclosed space. Open doors and windows and allow the space to air out for at least 30 minutes before entering. Research from the University of New Mexico found that approximately 12% of deer mice in rural areas of the American Southwest carry sin nombre virus. That is roughly 1 in 8 mice in those regions. Understanding that you may be dealing with an exposure risk rather than a simple cleaning task changes how you approach it. Number 4, use the correct protective equipment and understand why the type matters. When entering any space with evidence of rodent activity, an N95 respirator is the minimum acceptable respiratory protection, not a surgical mask, not a cloth covering. A certified N95 that creates a tight seal around the nose and mouth and filters at least 95% of airborne particles. Standard surgical masks allow air to flow around their edges and provide essentially no protection against aerosolized viral particles. Add disposable nitrile gloves. For significant infestations, disposable clothing that can be immediately bagged and laundered in hot water. Pre-ventilate the space by opening all available windows and doors and allowing fresh air to circulate for at least 30 minutes before entry. This reduces the concentration of aerosolized particles in the air before you enter. After age 75, pulmonary reserve, the extra breathing capacity that activates under stress, is reduced by approximately 35%, according to published research. The biological margin for error is narrower than it was. The equipment exists. It is inexpensive. There is no logical reason not to use it. Number 3, use the wet cleaning method. This is the one most people get completely wrong. If you have found evidence of rodent activity and you are ready to clean, the single most important thing to understand is this: never dry sweep, never vacuum without a HEPA filter, never use a leaf blower in or near a contaminated space. All of these actions aerosolize the virus particles and create a cloud of infectious material that goes directly into your lungs. The correct protocol involves thoroughly wetting the affected area with a disinfectant solution before touching anything. A mixture of 1.5 cups of household bleach per gallon of water, applied and allowed to soak for a minimum of 5 minutes, works effectively. Then, wearing your N95 and gloves, use paper towels or disposable cloths to pick up the dampened material and seal it immediately in a plastic bag. Double bag it. Dispose of it in a covered outdoor trash container. Wipe all surfaces where rodents have traveled with the same solution. According to guidelines published by the New Mexico Department of Health, the wet cleaning method reduces exposure risk by an estimated 90% compared to dry sweeping. For an aging immune system with reduced airway clearance and reduced innate response capacity, this is not a best practice. It is the practice. Number 2, know the specific symptom pattern that requires emergency action immediately. The window between the beginning of respiratory symptoms in hantavirus infection and the point of critical deterioration is measured in hours, not days. Research published in the Annals of Internal Medicine found that patients who communicated a potential hantavirus exposure history to their treating physician within the first 24 hours of respiratory symptoms had meaningfully better outcomes than those whose exposure history was identified later. The specific pattern to act on immediately is this: fever above 101 degrees Fahrenheit, combined with muscle aches in the large muscle groups of the thighs and back, combined with any shortness of breath that is getting worse over hours, in someone who has had any potential rodent exposure within the past 1 to 8 weeks. That combination is a reason to go directly to an emergency room, not urgent care, not a scheduled appointment 2 days later, an emergency room, today. When you arrive, say specifically and clearly to the treating physician, "I may have been exposed to hantavirus. I was near rodents approximately this many weeks ago. Please evaluate me for this." In a busy emergency room, hantavirus is not at the top of anyone's differential diagnosis list. You have to put it there. Early recognition creates access to early transfer to facilities with ECMO capability, extracorporeal membrane oxygenation, an external support system for lung function that gives critically ill patients their best chance of survival. The patient in Washington state who spent 18 days on a ventilator survived, in part because he received appropriate intensive support early. Delayed recognition changes those outcomes. Number 1. Have a direct conversation with your physician about your specific hantavirus risk before the exposure season peaks. A 2022 survey by the American Geriatric Society found that fewer than 8% of adults over 65 had ever discussed zoonotic disease risk with their primary care physician. That is the category of illness that transfers from animals to humans. Fewer than 8%. Here is what a physician conversation achieves that no amount of bleach or N95 masks can. Your doctor can assess your individual immune status. They can review whether your current medications, certain antihistamines, corticosteroids, some blood pressure medications, may be suppressing your immune response in ways that increase your vulnerability. They can document your exposure risk on your chart so that if you arrive at an emergency room with respiratory symptoms, the connection to hantavirus is made immediately, rather than discovered days later when the window for optimal intervention has narrowed. They can ensure you are flagged for priority transfer if you do become ill. There is no vaccine for hantavirus. There is no prophylactic antiviral. But an informed physician who knows your risk profile becomes your early warning system and your advocate in the scenario you most need an advocate. Walk into that appointment with specific information. Tell your doctor about the spaces on your property, where you spend time in summer, whether you have found evidence of rodents this season. Ask directly what they should know about you if you ever arrive in the emergency room with respiratory symptoms. That conversation, specific and proactive, is the most powerful thing on this list. Here is what I want you to leave with. Hantavirus is not a theoretical risk for people who live near or spend time in rural or semi-rural environments. It is a documented, recurring risk that disproportionately affects older adults because of specific, well-characterized biological vulnerabilities that come with age. The immune system changes, the airway defense declines, the margin for error narrows. None of that makes you helpless. It makes preparation more important, more specific, and more worth doing now rather than after something goes wrong. Do the rodent audit this week. Get the N95. Learn the wet cleaning method before you need it. Memorize the symptom pattern that requires emergency action. Have the conversation with your doctor before the summer season brings more time outdoors and more contact with spaces that rodents may have occupied over the winter. Everything here is for educational purposes only and is not medical advice. If you are experiencing any symptoms of respiratory illness, seek medical care immediately. What this video provides is the context to have a more informed conversation and to take more informed protective action. Leave a comment below telling me whether you have ever cleaned a space with rodent activity without protection, and whether any of what you heard today surprised you. I read every comment. I will see you in the next one.